Welcome everyone. In this segment we are going to take a look at the two scapula, or shoulder blades. We are looking at the posterior view of the left and right scapula. I can tell right away that this is a posterior view because I find this thing, which is called the spine of the scapula, and that sticks off posteriorly. And the scapula here, again, the spine. If I was to flip the scapula over and look at their anterior surface, what I see is this is very smooth surface. This is a large flat depression on a bone, and a depression on a bone is called a fossa. This is called the subscapular fossa, and that subscapular fossa sits on the anterior side, or the ventral side of the scapula. So we're going to come in and take a closer look, and we're going to actually put away this left scapula for a moment and just focus on the right scapula. We're going to run through it from a posterior view first, and then we'll come back and take a look at the anterior view of the scapula. So the first thing that I want to notice is that the scapula has four edges, or I'm sorry guys, I misspoke, has three borders or edges. We have a lateral border here, a medial border here, and then a superior border up at the top. So it makes a triangle shape, three sides, 1, 2, 3. Lateral, medial, and superior. I can tell the lateral border right away because if I turn my scapula a bit, I see this flat fossa here. This is called the glenoid fossa or cavity, and that's where the head of the humerus is going to connect in our shoulder joint. Looking at the posterior side of the scapula, I also see two flat depressions. I see one under my spine, and then I see one above my spine. We're going to name them the infraspinatus, infra meaning below, spinatus meaning spine, and up here the supraspinatus, above the spine. Supra means above. So supraspinatus fossa, infraspinatus fossa, and then that spine creating a nice delineation between those two fossa. On the lateral side of my spine, so this is all my spine, I get this big process that sticks off, and that process is called the acromion process. We can see it posteriorly, we can also see it anteriorly, and you can feel it in your own shoulder. So if you reach out to your shoulders and go as far lateral as you can, you're going to feel a bone sticking out there, and that's your acromion process. Excellent. So that's the posterior side of our scapula. Again, we're going to repeat this just one more time. We'll hit our borders first. Medial border, lateral border, superior border. The spine of the scapula and the acromion process, the infraspinous fossa, and the supraspinous fossa. Now let's flip this over and take a look at the front, or the anterior view of our scapula. Again, let's start with our three borders. We have the medial border and the lateral border, and I can identify that lateral border easily by looking for that glenoid fossa where my humerus will attach or articulate, and then up at the top, my superior border. I can see a little bit of the acromion process from the anterior view, but the big process that I see here is this big hooked sort of C-shaped process, and this here is called the coracoid process, and that coracoid process is going to be an attachment point for several important muscles. Here's a superior view of that coracoid process right there, and I'm holding the scapula by the acromion process. So acromion process, coracoid process, and again that glenoid fossa or glenoid cavity. Okay, let's repeat that using the left scapula. Okay, so my first question is this an anterior posterior view of that scapula? It's going to be an anterior view, and I can tell because of this nice subscapular fossa. That's a nice smooth spot on the front. If I flip it over to the reverse, the posterior side, I get that sharp spine ending in the acromion process there. Below the spine, my infraspinous fossa. Above the spine, my supraspinous fossa. And again, acromion process, coracoid process. For my three borders, medial, lateral, superior. Now don't be surprised on the exam if we put a scapula on the table in front of you and ask you without picking it up whether it's right or left. So you should practice a little bit with that. We can tell that this one belongs on the left side because this is posterior, and then identify medial and lateral, and that should help you figure out where it goes inside of your body.